Welcome to the National Gaucher podcast. My name is Amy Blum, and I am the Chief Operating Officer at the National Gaucher Foundation, an independent nonprofit dedicated to serving U.S. patients with Gaucher disease and their families. Through financial support, educational programming, patient services, and collaboration with medical professionals, the NGF empowers Gaucher patients to live a better today. Today's podcast is part 2 of a series focused on the basics of U.S. health insurance and how it affects Gaucher patients and their families. We'll specifically be talking about U.S. health legislation, how it works, and what's on the horizon. I am thrilled to introduce our special guest, Claire Sachs. Claire lives in the Washington, D.C. area, and she's been a cog in the wheels of big healthcare for over 30 years. She has been a patient, beginning at the young age of 6, as well as a caregiver. She built a team to help her stay on track of her medical needs. She has managed complicated insurance coverage, studied policy, and acted as a counselor to friends, family, and colleagues. She has clarified the system for them, helped them avoid painful mistakes, and advised them how to make themselves heard. Now she shares her expertise with you, a diverse patient community throughout the country, through her bi-monthly e-newsletter and blog posts in the Patient Advocates Chronicle. You can find her on Twitter at the Advocate is in, and on Facebook. Claire, welcome to our podcast, and thank you so very much for joining us today.
Thank you for having me, Amy.
So let's just jump right in because there's so much to cover. And often, I think even more frequently in recent months, it could make a lot of people feel like they have whiplash trying to understand what's going on here. I'm thinking that we should just start with some of the basics, providing that all would go smoothly, and how legislation is actually passed, where it starts, and that general process. Would you like to share a little bit?
Yeah, absolutely. So a bill can be introduced either in the House or the Senate. All bills relating to taxes have to be introduced in the House, though. So when we talk about the current healthcare bills, the Supreme Court decision several years ago deciding that Obamacare fell under taxes, that's why you see most of the activity originating in the House. So what happens is a senator or a congressman or a group of senators and congressmen will introduce a bill, and it'll be assigned out to a committee and often to a subcommittee. In those committees, that's when you have the legislator who has a specialty in that field, sometimes, or at least their staff does, put it through questions and hearings, and they bring experts in, and people who want to put forth their opinion and their expertise on the official congressional record can do that at that time. When it comes out of committee, there are recommendations made, and the bills are set up for public debate, which is where any member of whichever house it is can make their comments or propose amendments to the legislation as it is. And then it goes back and it gets, the amendments are either accepted or rejected, and the house that it came from gets to vote. And if the bill passes, it has to go up to the Senate if it starts in the House, and usually the Senate, or whichever is the second house, will reject it because it doesn't quite meet their criteria for that same topic. And so there will be something called a conference committee, which is people from either side of the House and the Senate will come together just to talk about that particular bill. And they will negotiate and come up with something that they think will pass both houses. And it comes out of that process and has to have a revote in both houses, where the bills for the House and the Senate match exactly.
Okay, and we've recently seen this played out in the media, actually.
Yes, we have.
In terms of specifically the tax legislation, which actually just passed today as we're recording this at the end of December. So we've watched through the media where the House comes up with one version of a bill, excuse me, the Senate goes back and says, you know, we won't pass it with X, Y, and Z a part of it. And then they come up with something that works together for them. So we've actually just witnessed a perfect example of how a bill goes through both sides and then comes through and has been approved. And so the next step is it goes up to the president, right, and the executive branch.
Correct, because it can't be signed into law without the approval of the president. Okay.
And when are there some variations in this process? What might be some unique aspects that we might see from time to time?
Yeah, there are a few. The first one I wanted to talk about is reconciliation, which you may have heard with regard to the Republican attempts to repeal the Affordable Care Act. So what that means is that before that particular session of Congress starts, the Speaker of the House and the Majority Leader of the Senate are informed that, or they inform their caucus that if they want to get particular legislation passed that's related to finance and taxes, they should write it in a particular way. And that means that in the Senate, it will only require 51 votes to pass instead of 60.
Interesting. So, and let's take a step back so that if there are people that don't understand when we use the word caucus, can you define caucus and how that works?
So the most broad definition of caucus is a group of people with common interest. The biggest ones would be the Democratic caucus versus the Republican caucus, where all of the members of that particular party belong to that caucus. One caucus you may hear about quite frequently is the Freedom Caucus in the House, which is a wing of particularly fiscally conservative Republicans who, if they don't agree with what their own leadership wants to put forward because it spends too much money often, they can actually stand in the way of the passage of a bill because their membership, I believe, is somewhere in the 30s. So right now it's enough. If Democrats don't want to vote for it, the Freedom Caucus is enough to hold up the bill and, you know, get concessions for themselves before they agree.
Okay. So especially when you're talking about the House and the Senate being a majority for one party in both, right? It makes it easier if that party is the one that is really interested in pushing certain legislation through. It makes it easier, and certainly this reconciliation helps in that regard if there's not a whole lot of bipartisanship appeal to a particular piece of legislation. It makes it easier for them to get a bill to go through and be passed.
Right.
Okay.
That's right.
And
so
when are there certain circumstances or special circumstances that the executive branch, the president can do certain things and change law that might already be existing without needing the House and the Senate?
Right. So if the president gets frustrated by lack of action on a particular subject in Congress, he can look to his own branch, which is all the agencies. So the agencies are responsible for making sure that the laws are followed, and they get to decide how, private industry or individuals follow particular laws. So he can issue an executive order directing his agency to take particular action or stop taking particular action. One really good example of that is the cost-sharing reductions that the president stopped paying for in October.
Okay. the cost sharing reductions as they go as applied to the health insurance and through ACA?
Correct.
Are the
So,
subsidies?
right. So, long story short, the cost sharing reductions, or CSRs, were subsidies that the government paid to insurance companies so that they would reduce the cost of both premiums and out-of-pocket expenses like deductibles and copays for low-income users of the ACA. So when the president decided that he wanted to stop paying those, he wrote an executive order directing the Department of Health and Human Services to stop paying those. They'd already been a little bit controversial before that. When the ACA was first passed, the Affordable Care Act, or ACA, or often referred to as Obamacare, was first passed, the CSRs ended up in court. And what happened was the court ruled that the CSRs could not go forward, but the Obama administration appealed that decision and kept paying the CSRs while the appeal was in process. So in order to stop paying the CSRs, all the president had to do was drop the appeal of the court's decision.
Which is what he did in October.
Yes, exactly.
Okay. And how has this affected people so far, or has it during the last quarter of 2017?
It's affected people who are signing up or have signed up for Obamacare just very recently. Because what happened was many insurance providers in the individual markets saw this coming and braced themselves and increased premiums. So what happens is the lowest income folks who are getting policies through the ACA, they have to get subsidies. So if the president takes away the CSRs, but the lowest income folks still get their subsidies, then the premiums on the next step up in income, so the middle class folks who are applying for an Obamacare plan, their premiums go up.
And this is part of the reason, or the reason, why so many of us throughout the United States have seen such a huge percentage increase in our premiums that for renewing 2018 policies. Is that correct?
That is correct.
Okay. So let's kind of jump a little bit, because it's all kind of tied together. And we mentioned briefly in the beginning of the podcast that this new tax legislation was just passed today, or I should say it was passed through the House and the Senate have both voted to pass this new legislation, and it's now awaiting signature from the president. But there is an impact that we expect to be felt on healthcare and in relation to healthcare. So let's talk about that for a little bit, because that affects our community tremendously.
Yep. So there are two areas of impact that this bill might have on healthcare. One is fairly obvious. The tax bill has repealed the individual mandate, which is the requirement for everybody, whether you're sick or healthy, to have health insurance, which is a major part of funding. So that is going to be an impact that's quite similar to the repeal of the CSRs, which is the lower income families still they get their subsidies under the law, because Obamacare has not been repealed. It still exists. So you still get your essential health benefits. You still, which includes like free preventive care, things like that. There are still no caps on catastrophic care, all the things that the law laid out. But what they've done is they've yanked out the largest piece of funding. So that's one, and that'll do the same thing. And estimates are that premiums will increase by about 10% a year for the next 10 years.
Wow. That's
right.
Huge.
It is, and what it'll do actually is that it will mean that fewer people are signing up. So that is actually a way that I'm sure the authors of this bill considered tanking Obamacare, was that fewer people will sign up, so there are fewer people paying in. It also means that healthy people are not required to pay into the system, which basically creates a giant high-risk pool, which is not good for premiums, because if you have a pool of insured people who only have, high levels of health issues, then there's no way to lower costs, to defray the cost over the entire community.
So in essence, between the executive order to cease the CSRs, excuse me, and this new component in the tax legislation, which will not be in effect for 2018, but would be in effect for 2019, where the individual mandate is repealed, those two pieces together are significantly impacting funding that should be in place to help pay for ACA plans, the marketplace plans. And therefore, those of us who have a significant need for health coverage because we have health needs are going to be stuck trying to cover the deficit, if you will, by through increased premiums.
Right. And they estimate that the people who will be the hardest hit by this are individuals who are making $48,000 and families who are making about $98,000. So right smack in the middle if you look at the entire country.
Okay. And to date, there's nothing that's been proposed in terms of legislation as to how to help ensure that healthcare is something that everybody should be entitled to, and figuring out ways in which, as a country, we can be working together to make sure that people have access to affordable healthcare.
That's correct. There have been talks about addressing it early next year, but nothing solid. And I did want to mention one other thing that was in the tax bill that I only learned about today, which is for those of us who itemize our medical expenses, for the next 2 years, that cap where they say you can itemize everything that exceeds 10% will actually drop to 7.5%. So that's actually being decreased for 2 years, and then it'll go back up to 10% after that. Okay, so that's a little bit of a benefit for those of us who have a lot of medical expenses and typically itemized. So there is a little bit of a benefit to that. One of the other big topics that has been a part of the Gaucher community, and I'm sure many other disease communities, is what's been going on and changes in the Orphan Drug Act. So let's talk about that a little bit. So one of the things in this tax bill also is that the Orphan Drug Act tax credit that is given to pharmaceutical and biotech companies for clinical research is actually going to be cut in half. It was 50%, and now it's going to be cut down to 25%, which equals about $27 billion over the next decade.
And as a direct result of that, there's a concern that these pharmaceutical companies now will not have the incentive for research and development, in particular for these rare diseases, treatments or cures for rare diseases, because it's such a small population, and it will not afford them the opportunity to recoup those R&D dollars.
Well, yeah, and the R&D dollars are a little bit higher for orphan drugs because it's a lot harder to recruit the necessary population to have an effective study, because it's such a small population and very dispersed usually.
And has there been put forth any ideas as to, now that this legislation has kind of come through, how we can, continue to move forward and help what becomes a pretty sizable community if you take all of these rare disease communities and you put them together,
right,
versus looking at them as, individuals.
Right. There are about 7,000 rare diseases that this covers, which equals 25+ million Americans. So yeah.
It's a lot of people that will
It
be
is.
Negatively impacted if the research doesn't continue towards the development of treatments and cures for these more obscure or rare diseases.
Right. I have not seen anything to address that in the last few days. I think everyone's going to have to take a few minutes to take in what's happened and what the impact's going to be. And I hope that there are going to be plans, but I haven't seen any.
And there's another aspect of healthcare that impacts not just rare disease communities, but it ties into subsidies and assistance for people who need health coverage. And that is the CHIP, the Children's Health Insurance Plans that many states were offering. Just a short time ago, we know that there was a continuing resolution to push the budget off in terms of, a vote for a longer term to get us into the early calendar year for 2018. But how is this being impacted? How is the CHIP program being impacted right now by the current legislation and what's been going on?
So what happened was, let me back up and tell you a little bit how CHIP came to be. After the initial failure of the healthcare bill in 1993, senators got together and started talking about what they could do to help, children that didn't have healthcare. And so in 1997, Orrin Hatch and Teddy Kennedy got together and passed CHIP. It had a ton of bipartisan support, and it's been refunded, like they have continued funding and reauthorized CHIP several times with bipartisan support. And actually right now they still have bipartisan support, but the initial proposal in, I believe it was also October of this year, wanted to take funds from Obamacare's Public Health Fund, which funds health centers in underserved areas, and they wanted to shorten the grace period for people who forgot to pay for their insurance under the ACA, and they wanted to make Medicare premiums higher for higher earning seniors. So that was a no-go for Democrats, and so they put it on a back burner and let funding lapse around September 30th. And since then, they've tried to do the last-ditch Obamacare repeal, as well as the tax funding, or the tax bill that just passed, as priorities. And meanwhile, a lot of these states are running out of funds. A few states will be completely out of funds by January 31st. Now, the tax bill that just passed, or the continuing resolution that just passed, does have a small extension, like a little continuing resolution just for CHIP. About $2.8 billion. It would cost about $8 billion to fund the entire year, so this funds CHIP through about March. Yeah.
And it's important, just to kind of tie in the last podcast that we had, we addressed these different forms of health insurance, where there's private health insurance, which is still a large part of what people who are in the marketplace and trying to go through for ACA. There are different private health care plans that they're trying to access. And then there's also the Medicaid component for those who really need to be fully subsidized. Is that a correct statement in terms of accessing health insurance?
Yes, and so where CHIP falls is for families that don't have an income that is low enough to meet Medicaid standards, but they can't afford the Obamacare or ACA standards, or the plans offered by the ACA. So they can get their children covered. And the statistic I saw was that for a family of 4, these are people earning about $48,000 a year. So, and we're not talking about just regular medical care. A lot of these kids have autism or diabetes or even cancer. So if these funds run out, ostensibly they could take kids out of cancer treatments in the middle. There's no backup for CHIP. CHIP is it for kids.
Right, and it's this is one of these essential, really life-saving programs for so many that throughout the country. Well, this has been so helpful, Claire, in terms of being able to help people really understand what goes on, what's involved with changes in legislation. And the last thing I'd really like to be able to leave our listeners with is, what can people do when they feel like they want to have their voice heard in some way, shape, or form? How can they be a part of this process in a meaningful and constructive manner?
Sure. I know that a lot of us have felt really helpless and frustrated over the last almost year or so. So it's been a very relevant topic. What can I do? So the first thing you should know is that communication with your representatives, your elected representatives, is absolutely vital. Everyone from the state folks up to the federal, the House and the Senate, and even the office of the president, whether you voted for those people or not. Especially in congressional offices, there is a minimum number of contacts from their constituents that will escalate an issue up the chain. So the more they hear from you and the more passionate you are about it, the more you're going to get the attention that you want. So I would encourage you to find out who all of your representatives are, if you don't know already, and call, phone, show up in their offices. They don't necessarily frown on that. In fact, they like to hear from the people who elected them, or even their opponents. You're still someone who may or may not vote for them, and if they want to be bipartisan or get more support from their community, then they have to know how. So there's a website called Project Vote Smart that, if you don't know who your elected representatives are, they'll tell you all the way down to the local level, as well as their voting records and their offices.
So, and what was that website again? It's Vote Smart?
Yes, I believe it's votesmart.org.
Okay. And we will make sure that we link this when we publish. We will make sure that we have the proper website to be able to provide our listeners with an easy way to just click on and be able to identify their appropriate leadership and the contact information, so that they can reach out and they can call and they can send letters, and if they're able to, go in person and let their voice be heard.
Right, or go ahead, sorry.
No, I was going to say, just to let their voice be heard. It's really important.
Right, and remember that their offices aren't just in Washington. They all have more localized offices in their home states, and a lot of times they hold town hall meetings, especially when they go home from Washington over breaks like the one coming up soon.
That's a wonderful piece of information for most people to think about. And remember, they probably associate, at least on the federal level, their representatives and senators being in Washington, D.C. And we forget that there are local offices with staff there as well, all throughout the year. So that's all the time that we have for today. Thank you, Claire, so very much for sharing your insights on this very important topic. As an expert in the field and as a patient and wonderful advocate, I thank you for sharing your experiences and helping the larger Gaucher community. We are really grateful for your time. Thank you to our listeners.
Thank you so much for having me.
Thank you so much. And we want to thank our listeners too, because if you want to learn more about Gaucher disease or the National Gaucher Foundation, please visit gaucherdisease.org, GAUCHERDISEASE.org. You can sign up for our monthly newsletter, read articles and blog posts about living with Gaucher disease, as well as patient stories and videos. You can also follow us on Facebook. Please check back for future podcasts from the National Gaucher Foundation. Thank you, and we hope you enjoy the holiday season, and join us again next time.